Hello everyone, this is Tanya Yadav. I am MBBS intern at KCMU Lucknow. Today we will study about the anatomy of the topic extrahepatic biliary apparatus. Before going to the further details, first we will see what are the constituents of this apparatus. There is right and left hepatic duct which form the common hepatic duct. Then this common hepatic duct combined with the cystic duct which is coming from the gallbladder. This cystic duct and common hepatic duct combine to form the bile duct, which is also known as the common bile duct that opens into the second part of the duodenum. Yes, these are the constituents: right and left hepatic ducts, common hepatic duct, gallbladder, cystic duct, and then bile duct. What is the function of this extrahepatic biliary apparatus? It collects bile from the liver that is present here, and then it gets concentrated into the gallbladder before going into the small intestine. Okay, so now we'll study each part into the further details. There is right and left hepatic ducts that emerges at the porta hepatis. Porta hepatis. What does it mean? Portal to hepatis, that is entry to the liver. It is a very common question that is asked: what is the sequence of the structures present at the porta hepatis? First of all, we will see the structure, and these are portal vein, hepatic artery, and hepatic ducts, which are also known as bile ducts. The sequence is, I'll tell you the trick that P for portal vein. That is P. P is portal vein, P is posterior. See in this diagram, the portal vein is the most posterior structure at the porta hepatis. Then anterior to anterior to portal vein is hepatic artery. See, and then hepatic duct. The sequence from posterior to anterior is from posterior to anterior. It becomes PAD, pad, that is portal vein, hepatic artery, and hepatic duct. This is the important thing that is commonly asked from this slide. Then there is nothing important in this slide. Common hepatic duct is formed by the hepatic, right hepatic, and left hepatic ducts. Okay? Then it continue downwards. Then the important structure of this apparatus is the gallbladder. The shape of the gallbladder that you can see and appreciate easily is the like a pear shape. Okay. Gallbladder has four parts. First of all, fundus, body, neck, and then there is a cystic duct that arises from the gallbladder. It is divided into fundus, body, and neck. The important thing is that the tip of the gallbladder lies at the tip of the ninth costal cartilage on the right side. It becomes the significance of Murphy's sign. That is a very important clinical sign into the acute cholecystitis, in which when we press at the position of tip of ninth costal cartilage on the right side, the patient winces with the pain. Okay. Then there is an important thing for the surgery that the gallbladder body is lies in the fossa of the gallbladder. This gallbladder fossa is formed by the quinoid segment 4B and 5. Okay, these are the two segments which form the gallbladder fossa. Then moving to the next slide, we will study about some functions of the gallbladder. It is very important, as I already told you, that it stores the bile, and then when it is required, that is after feeding, it releases into the duodenum. What does it do while storage? It absorbs water from the bile and then concentrates it. Okay. Normal gallbladder also absorbs some small amount of loose bile salts, cholesterol compound, not that important. Moving to the next slide. Then a cystic duct arises from the gallbladder. The length of the cystic duct is around the 3 to 4 centimeter long, and it has some spiral walls. Then there is one more important structure apart from gallbladder into this extrahepatic biliary apparatus is bile duct, or this is also known as common bile duct. The length of common bile duct is nearly 8 centimeter. Okay. So the important thing to study about the relations of this common bile duct. This common bile duct is divided into four parts. First, supraduodenal part, then duodenal part, या फिर this is also known as retroduodenal part. Okay, just behind the duodenum. Then third is infraduodenal, below. Then the fourth part is the intramural into the wall of the duodenum. So we will see the diagram and then study about the relations. See, look, this is duodenum. So the part above this is known as the supraduodenal part. As you know, this liver is lifted above in this diagram. So if you place it in its anatomical position, then it lies anterior to this part of the CBD. See, anterior means the anterior relation is from the liver. Then you can easily see that behind this is the portal vein and the left side is the hepatic artery. All these diagrams are clear. See, this is liver, hepatic artery, and behind this is the portal vein. Now come to the retroduodenal part. This part is the retroduodenal part, and this is the whole retroduodenal part. So you can easily see behind the retroduodenal part is what? This is the whole inferior vena cava, and to the left is the gastroduodenal artery. Okay, then anteriorly, this is the first part of the duodenum. Now come to the inferior part, that is infraduodenal part, which is lie behind the pancreas, see near the head of the pancreas, and the posterior relation to the IVC. And then this part goes to the intramural part. So why we are studying? All these structures have surgical importance. Okay, then when you will go into your final year and you will study in surgery, that this supraduodenal part is the most accessible part. Sorry, it is the most accessible part, okay, for surgeons. Okay, then this is difficult to explore. Difficult to explore. Okay. The most important part is this part. So when you will study about the obstructive jaundice, you will see one of the cause is the periampullary carcinoma. So periampullary carcinoma, specifically carcinoma head of pancreas, involves this part. So when you will study further, then you will able to understand this part. I'm just telling you in a bit so that you have just the basic idea when you will study the surgery. So there are the four parts: supraduodenal parts, retroduodenal part, infraduodenal part, and the intramural part. On which the most important in case of obstructive jaundice is infraduodenal part, and for it is very easy to surgically explore is the supraduodenal part. So this is the important slide of the whole PPT. So you can easily write into your exam. Okay. Now there is we'll study about some sphincters related to the pancreatic and bile duct. So we'll understand by the diagram of this. You have heard about the sphincter of Oddi. So I want to tell you this is not a single sphincter. It constitutes three sphincter. Sphincter choledocus. Choledocus means common bile duct. So the sphincter that covers the common bile duct or bile duct is known as the sphincter choledocus. Then a duct known as the pancreatic duct is covered by a sphincter pancreaticus. Both combine to form a common duct which is covered by a sphincter ampulla. So all these three sphincters form the sphincter of Oddi. Got it? So this is also important. Now, see, this is another picture showing the sphincter of Oddi. This is the common bile duct, pancreatic duct, forming the common duct which is covered by the sphincter of Oddi. Now, there is one important thing that you have to understand about the histology of the gallbladder. Just basic anatomy that I have told you, it is more than enough for the first prof. So, in the histology, I want to tell you one important point, and that is we have seen four layers into the GIT: serosa, submucosa, muscularis layer, and then mucosa. So you can easily see that there is serosa, there is muscularis layer, there is mucosa. So which layer is missing here? The layer missing here is known as submucosa. So gallbladder does not have submucosa. Okay, so this is the important point that you have to remember. Next, we'll study about the arterial supply or nerve supply. So this is a single slide in which in the this is a single slide that you can write and understand. Artery which supplies the gallbladder cystic artery. I am telling you the main. Okay. So the rest of there is another arteries that are also supplying, but the most important artery is the cystic artery, then cystic vein, cystic lymph node, cystic plexus. Very easy to learn. And the nerve supplies is all also vagus nerve at T7 to T9. Okay. So this you have to learn. Now, I have told you about the bonus tip that I'll tell you at the last. And that bonus tip is that when you write your answers into the in anatomy exam, just writing after an answer, you just have to add one clinical point. What clinical point? Relevant to anatomy. Relevant to anatomy. Just like I have teach you about that topic extrahepatic biliary apparatus. So I am going to teach you about one or two topics of that related to topic. So gallstones. So how gallstones are formed? So first of all, gallstones are of three types. You can easily see the gallstone are of three types: cholesterol stones, pigment stones, and mixed stones. Okay. Then another topic is cholecystitis. So cholecystitis is known as the inflammation of gallbladder. So this is the and it presents with the Murphy's sign. That is, I have told you, deep pressure at the GB point. GB point was what? The tip of ninth costal cartilage at the height of inspiration. Patient feels stabbing pain and catching breath. And the symptoms of cholecystitis is biliary colic, jaundice, and Murphy's sign positive. I hope you liked it. Thank you. All the best.